Malaria, From Silent Killer to Global Health Crisis, written by Lilly Richardsen, narrated by Fendersen. Chapter 1, Introduction to Malaria. Malaria is one of the world's most enduring and devastating infectious diseases, with a history that spans thousands of years. It is caused by a parasite from the genus Plasmodium and transmitted to humans through the bite of infected female Anopheles mosquitoes. The disease affects millions of people annually, with the greatest burden in sub-Saharan Africa, though it also impacts parts of Asia, Latin America, and other regions. Despite decades of global efforts to control it, malaria remains a major public health crisis, with significant social, economic, and health-related consequences. Historically, malaria has been a silent killer, often misunderstood and underreported due to its symptom similarity to those of other illnesses, such as flu or viral infections. For centuries, it was a mystery to scientists and physicians who struggled to understand its causes and transmission. It was not until the late 19th century that the true nature of malaria was discovered, when scientists like Sir Ronald Ross uncovered the link between mosquitoes and the spread of the disease. This discovery laid the foundation for subsequent efforts in prevention and treatment. The global burden of malaria is staggering, with estimates suggesting that over 200 million cases occur each year, resulting in hundreds of thousands of deaths, mostly among children under 5 years old. The impact of malaria goes beyond just the number of cases and deaths. It also affects economic development. Countries heavily burdened by malaria face reduced productivity, increased healthcare costs, and hindered education, as children and adults alike are repeatedly affected by the disease. Malaria's transmission is influenced by a variety of factors, including climate, geography, and human behavior. Warm temperatures, stagnant water, and poor sanitation provide ideal conditions for the breeding of mosquitoes, which in turn increases the risk of malaria transmission. Changes in the global climate and rapid urbanization also complicate the fight against malaria, making it a dynamic challenge that requires constant adaptation of strategies. Efforts to combat malaria have made significant strides, especially in recent decades, with tools like insecticide-treated bed nets, anti-malarial drugs, and targeted mosquito control programs. However, resistance to both drugs and insecticides has emerged, threatening to undermine these advances.
Sample complete. Ready to continue?